right, so our patient has had 5 to 10 minutes to relax and kind of get used to the appliance. What you'll notice is the more you sit there, the more comfortable it becomes. You'll also notice that you might start to salivate a little bit. Totally normal. Don't worry about it. So at this point, your dentist will come back in a couple of minutes, and it's important that you can demonstrate to him or her that you can take the appliance in and out. If when you put the appliance in, it doesn't feel too tight, sometimes it's difficult to get out. The recommendation that I want to give to you is that when you're ready to begin practice taking it in and out, it doesn't work as well if you pull from the front. And the reason is that your front teeth tend to be angled out, so a lot of the retention is in the front. It actually works best to pull down from the back. You can do it one of two ways. You can take your index fingers and go all the way towards your back top teeth, all the way back in where your cheek is, and pull down. And on the bottom, you can do the same thing with your thumbs, go all the way back and push up. So for our patient today, we're going to assume that the bottom is a little bit easier to take out. So we're actually going to take the top out first, which is going to help him navigate to get back. So Chad, what I want you to do is I'm actually going to let you do this. I want you to demonstrate you can take it in and out. So I want you to take both of your index fingers, and I want you to go all the way back on the top, and I want you to pull straight down, and it should pop down, okay? I want you to do the same thing on the bottom, but all the way to the back and push up with your thumbs. Great. So I'll take that for you. I'm going to rinse it for you really quick. So now what I want you to do is I'm going to give you your appliance, and I want you to demonstrate that you can put it in without my assistance. Okay, so there's your appliance. See if you can orient, and remember the lower is the lower jaw is the one that won't go back. Okay, so if you get disoriented. So it's important that when you actually put the appliance in, you don't want to bite straight into it for a couple of reasons. One, you can damage the appliance, and two, it might not be oriented. So Chad was able to kind of get it close to being in the correct position and then actually bit into place. So Chad, great job. You can go ahead and take that out. Good job. And then once your morning aligner is made, we're going to put that morning aligner in your appliance. So actually we've already made yours, so we're going to put that in there for you. And Chad, great job today. You're a great patient. I'm going to see you in 1 week for your follow-up. Do you have any questions about any of the things to expect the first week?
No, thank you.
All right. If you get lost or have some questions, just go online and watch the videos, okay?
Thank you much.
All right, thank you. Thanks for watching.